Welcome back to Scolipod. Greetings from Dubrovnik, Croatia. Dr. Beth and I have spent the last 4 days learning all things scoliosis, and we wanted to log in and just provide a little bit of an update on everything that we learned this past few days. So, Dr. Beth, why don't you start off by telling us about Wednesday and what we learned?
Absolutely. So Wednesday was our pre-conference, and usually the pre-conference is more of an educational section to go over kind of what is the most updated research on different scoliosis topics. So the topics they chose this time were adult scoliosis, which I was really excited about,
Same.
and then brace dosage for teens with scoliosis. So, on the side of adult scoliosis, we talked about the different types of adult scoliosis. We have adult de novo type, which is people that develop scoliosis when they're older as a result of changes of their spine. We have adolescent scoliosis into adulthood, which is us, that we were diagnosed with scoliosis as teens and now we're grown up. And then they had the secondary scoliosis types, which might be someone who had a fracture or maybe a condition that spurred the development of their scoliosis. And that's one of the challenges with treating adult scoliosis is that we have different types. So it can be hard to look at research for adult scoliosis. There's actually only been 2 studies on the effect of physical therapy, scoliosis specific exercises on adults with scoliosis, showing trends in terms of improving their quality of life, as well as potentially improving their cob angle to a small degree, not as much as probably we see with teens and the exercises. So I found that really interesting. We also had a lecture on adult bracing, which I get a lot of questions about from our followers, because adult bracing is really a very new technology because adults don't have growth remaining. So when we use bracing with teens, we use it to adjust their growth. So using braces in adults, we're really not sure the dosage that is going to have a good outcome for adults. So we're still learning, we're still researching that, different braces that they're using on adults, from soft braces all the way up to rigid braces. But they are seeing results in terms of reducing pain, improving some alignment. So excited to kind of see where we go forward in terms of adult bracing.
For sure.
Yeah. And then the last part of the pre-conference was we actually had a practical session where we got to observe different types of physical therapy scoliosis specific exercise. And what was nice about that is we're trained in a few schools of scoliosis exercise, but there are many schools actually that physical therapists can train. So we got an introduction to the ISST Schroth method, which we had neither trained in, and just a really starting a foundation of kind of what that method looks like. It's really interesting to see that many of these methods were built off the original practice of Katarina Schroth, but they've all kind of taken their own best pieces or best practice. So I think it's really good that we're be exposed to different types of scoliosis specific exercise techniques going forward. So it was really interesting to see that presentation. So that pretty much wrapped up the pre-course. What were your big takeaways from day 1 of the actual Congress?
Well, there were so many things. I'm actually going to take a little look at this really quick. So that first day, we talked a lot about the different types of, there are so many differences in muscle activation, muscle recruitment. There were some really interesting studies on fatty infiltration into muscles on one side of the curve. We learned a lot about different types of technologies that are coming up, including 3D bracing, like 3D printing for bracing, which is still being researched. So that's more to come on that. It does not replace expert opinion as of right now, but we are just looking more into that. There was a really interesting lecture from the SRS president on the types of surgery indications, the sagittal alignment, which is basically how the side profile really, how the side profile really makes a difference for scoliosis as well. There were research studies into like standing and walking and what the differences are for people with scoliosis, different types of scoliosis, and looking at trends. There was also a bit of a discussion on group exercise and how that can improve compliance with with being, I'm losing my words.
Yeah, with teens to be able to do their scoliosis exercises, there was a trend to show that the group class actually got them a little bit more into the exercise, more compliant. So that was good to see, and that's one of the big things we do at Strength and Spine is we do have like group program to be able to kind of get that group accountability in the sense. So if you're someone, I think the takeaway there is if you're someone with scoliosis, maybe finding a workout buddy or someone who you can go with that will help to keep you accountable.
Yep.
Yeah.
For sure. So lots of different breadths on that first full day of the conference, but some really interesting research coming up for sure.
Yeah. Yeah.
So that was Thursday. So
Friday, technically day 2 of the conference was the next.
Right. So Friday, that's where we are
Yep.
now. So
Yep.
I don't know if you want to take over.
Yeah. So for Friday was some interesting research on comparing physical therapy scoliosis specific exercise to general exercise. So just to differentiate those, there's many schools of physical therapy scoliosis specific exercise with the goal of correction of the curve, so a self-correction, and then stabilizing in that correction. So those are really the goals, and the different schools approach those in different ways. But when we talk about general exercise, we're talking more about maybe some general core strengthening, maybe some fitness type things, and how they compare for people with scoliosis. And the big thing that we found, and this was research in teenagers, that the physical therapy scoliosis specific exercise was more effective for improving the Cobb angle. So, and I think that makes sense because, of course, it's very specific to the curve. But in terms of improving quality of life, the general exercise and the scoliosis specific exercise were pretty similar. So I think that gives us the cue to also encourage our teens with scoliosis to do things outside of just their scoliosis specific exercise, whether that's fitness that they enjoy, whether that's sports. And it opened up a discussion for us about which fitness types we think are maybe better or maybe not for teens with scoliosis, right? Because we're always aware of a lot of rotation, a lot of flexion, things like that. So I think there's a further conversation down the line as to what general exercise means for teens with scoliosis, but that was really interesting. Another study was showing in terms of the quality of life of people with scoliosis, and actually there was no difference in the quality of life of curves up to the severity of 60-degree Cobb angle. So that means that you can have a 0-degree curve all the way up to 60-degree and have a good quality of life with that curve, which I think in the past, that cutoff they were kind of considering it lower, and that's why the recommendations for surgery were to operate at 45 or 50 degrees. But what the authors of this paper were saying is that maybe we should reconsider that, you know, if we're not having pulmonary complications, if we're not having issues with a tremendous amount of pain, should we reevaluate doing fusion surgeries at 40 or 50 degrees when you could have a curve all the way up to 60 and have a good quality of life? So I think that's something that I think is going to change a little bit how we approach. And there's a lot of questions too in terms of other aspects of having surgery at different curve severities. But it was interesting to see that you could have great quality of life all the way up into what we would consider to be severe curves. There were some studies on oxygen dynamics in the muscles, like to talk about the endurance of the muscles and how long that they'll be able to do an action. This kind of stuff is maybe a little bit above my understanding.
We are physical therapists, not exercise physiologists.
Right.
But it's all very interesting.
But the important thing, I think, was that they did find some differences in how the muscles are using oxygen on different sides of the curves when they compared that to controls that did not have scoliosis. So it tells us maybe those muscles are having some differences in how they're using oxygen, which would be related to the endurance of those muscles.
Yeah.
Okay. The only other thing we had on day 2 was actually some research on telehealth in terms of being able to measure on screen different parameters that we look at in terms of posture from the frontal view and also the side view with scoliosis. And of course, we really enjoyed that because we do a lot of work virtually. So it's exciting because this new technology will give us a way to be able to more easily trend how people are doing with their treatment and how their posture is improving. So I'm really excited to start using that program with some of my virtual clients coming up.
Definitely.
Yeah, so we can move on to day 3. Do you want to give a summary of day 3?
Yeah, let's do it. So day 3, this was our final day here. A bit of a shorter day, but it was definitely very action-packed. So there was a lot of discussion on screening, the importance of screening, all of the different types of screening tools that are available. There was a lot of discussion about which types of screening protocols are going to be the most effective. There was discussion on the use of ultrasound and different types of technologies to decrease that radiation exposure that we worry about with kids getting repeated x-rays. Some places have, different types of imaging systems that use less radiation, but that's still a concern. There was also a lot of discussion about types of outcome measures that discuss just quality of life and different types of things to help us standardize care across these different nations. Because as we've learned, we haven't discussed specifically on the podcast yet, but there is a lot of difference between nations on how this scoliosis is screened and assessed, and it's important that we're all using the same language. So that was really interesting to hear how they're validating which are the best outcome measures for us to use. There was also a lot of discussion about hypermobility as it relates to, so we haven't specifically discussed this yet either, but a lot of people with scoliosis have generalized joint hypermobility, which I'm sure we can discuss at length on a different podcast.
Yeah.
But essentially looking at how someone can have hypermobility, but not necessarily does that mean their curve is also hypermobile, but having more mobility in that curve can actually improve their outcomes when it comes to bracing and exercise. So it opens up a better discussion on how we can create more flexibility within our patients combined with stability, so combined with the strengthening and the stabilization of the muscles to get better outcomes, to decrease cob angles, to help people have less pain, and all of those types of things. And then I think at the end, in the closing statement, they talked a lot about the importance of just maintaining that what we call multidisciplinary approach to make sure that we are all of the different professions that were here. There's a lot of PTs and physiotherapists. There's a lot of orthotists, and there's a lot of orthopedists, a lot of different providers that are coming together to help to create a better future for those of us living with scoliosis, children all the way up through adults. And I think I just leave this conference feeling so much more inspired. Dr. Beth and I are talking already about how we can contribute to the literature and the research in the next couple of years. And I just always feel super stoked at the end of this, being able to go back and bring my people more information.
And I think as a person with scoliosis, sometimes it can feel a little bit like there's not a lot of information, or maybe like the research is not being updated. I can assure you that it is, but this takes time. It's a very complex condition. It's taking time to get the research on the page to be able to make these recommendations and to be able to share this with you. And I want to encourage, if you are a practitioner, maybe listening to our podcast, and you want to learn more about scoliosis or scoliosis research, to look at SOSORT as a resource and maybe consider becoming a member. We are both members of SOSORT, and we're proud to be physical therapy members for the conservative care of scoliosis. So if it's something you're interested in, you could always reach out to us or look on the SOSORT website for more information.
Yep, we'll include that in the show notes, of course. And also it gives you great opportunity to go to fantastic countries like Croatia.
Beautiful places.
Next year will be Italy, and then we'll see where it takes us after that. But we hope that this was super informative. So thank you for tuning in, and we will catch you on the next episode.
See you next time.
Bye.
Bye.